Morquio A is one of the MPS category of diseases, but it has similarities, but it has some pretty amazing distinctions from the other MPS, and the amount of bone and joint abnormality leads to hyperflexible joints, and it creates very different problems and challenges from MPS 6 or MPS 1. And when you're doing clinical evaluations, something like a 6-minute walk test or a stair climb, anything functional is harder on a patient who has very unstable, flexible joints. So in order to get good outcome, you need very good surgical support, anesthesia, neurosurgery, to be sure that their spine and limbs have the best chance to support mobility. Now we have therapy with enzyme therapy, which we hope will improve strength and endurance, and possibly, although unproven, the earlier you start, maybe we'll get better joint and bone development. So, but our challenge now that we've moved out of clinical trials is how can we monitor these patients? What can we do? We're doing these very sophisticated clinical interventions, and it's not adequate just to have them walk into the office and give you a report. Yes, I'm feeling better. No, I'm not feeling better. And treat their acute illnesses. You really have to be able to have some objective way of looking at the effect of the illness, the effect of the different therapies on their clinical state. So that's where we have management guidelines. We have lists of tests you can do. If you do them all, it's great. You really have to do them at baseline. If you miss your baseline, you've sort of missed the boat on trying to understand what effect enzyme replacement therapy might have on the disease. But even more, it's hard to get people to just come in and go through a battery of tests year after year and not have any sort of sense of how it really relates to their daily life. So we're starting to move to asking the patient to give us an idea of what they would like to see improve. If they're still walking, it might be improved endurance. Maybe they don't need improved endurance. Maybe their balance is not what they would like it to be, and they would like to be more stable, or they need to type faster, or they need to be able to write without their hand being exhausted in 15 minutes. And so you can sort of hear what they need to do at that time, and you record it, and you try to pick an outcome that might measure that objectively, and then follow that patient every 6 months, every year, and do those simple tests and record and maintain the documents. Now you've got your own record of what the patient suggested would be his desired outcomes. He's more interested in what effect the drug's having on his life activities, because they're ones that he chose himself. And we hope that this is going to help us manage these patients with tremendous diversity and different skills and activity levels and capabilities. So